Okay, I think we'll begin. I want to welcome everyone to the third workshop in the Community Engagement Workshop series. We are going to have our excellent presenter. She presented the first time as well, Laurene Tumiel-Berhalter. And I just want to tell you that a couple of things. There is a community engagement micro-credential that's going to be called Developing Strong Community Partnerships that should be available very soon. So if you are interested in it and you have attended these workshops, feel free to ask about it. I will advertise it once time has gone on, especially to people in this workshop series, once it gets completely approved. And even if you didn't attend this workshop series, all of them, you can still do it. I'm just going to give you videos of the sessions for any information you want to build background or to activate prior knowledge. I also want to tell you that they're free. I like to provide the free micro-credentials because I feel that they're open to more people, and I will work on your timeline. I'm very flexible with that. Second thing I wanted to state is that I'm going to be putting a survey in the chat box. So please, please, please complete that. I will also be sending it out twice. We need that to report to our basically for our grant purposes, and also we use it to improve the series. So pretty important. So I'm going to turn it over to Laurene. She did a stellar job in the first one, as well as Andy and Grace in the second one, and I'm sure this one's going to be wonderful as well. Thank you, Laurene. Over to you.
Great. Thank you so much for coming, everyone. I know it's end of the day and not so nice outside, so thankfully this was by Zoom and nobody has to travel. Okay, so this time, a couple weeks ago, we talked about just kind of an overview of community engagement, and then Grace and Andy really got into the nitty-gritty of working with plain language, which is definitely an art form in and of itself when we're talking more about communicating with other people that are outside of our field or outside of our area of expertise. And so today we want to get into a little bit more about engaging new community collaborators. And, this is always a tough thing. Sometimes it's, knowing who to reach out to and how to reach out to them. And, certainly our team at the Community Engagement Core for the CTSI are very willing to help and speed that process along for you. The one thing I do want to say is please, anyone, and again, this is a nice sized group, that please feel free to ask questions along the way. Definitely like to have an engaging conversation, and, don't need to necessarily wait at the end. We can definitely integrate others' experiences as we go along, because my lens is certainly not the only lens, and the experiences I have are very different than those that some of you may have had. So please feel free to share. So to get started, just thinking about what is the first word that comes to mind when thinking about engaging a community partner? And if you just click on the QR code, you should be able to enter in your response. And we'll give everybody a minute to do that.
Can't get that, there is a link in the chat as well. So you could also enter your word that way.
This is great. So culture of the community, opportunity, respect, collaboration, collaborate, trust, communication. These are all great words. Thinking about, reaching out to a community partner. And I know, and they're so positive. And I know that certainly, a few others have come to mind in my experience that I would add are things like sometimes fear or uncertainty, not knowing exactly how or who to touch base with, and thinking about all those things that I don't know about a certain community and how that might impact our first meeting. So, but I love that these are all positives, and I just share that some of my reservations as we go into meeting new groups. Okay. There we go. Okay. So, thinking about different researchers and different academic partners, whether it's researchers or educators or whatever our kind of academic hat is, really thinking about some genuine self-reflection before engaging any sort of community partner. Thinking about, and these are kind of hard questions to ask yourself and to really think about. In order to do good community engagement, you really need to approach things in a way that are opposite of what we're usually trained to do. So really think about whether you are genuinely interested in what a community partner has to say, or do you need them? So thinking about those RFAs that we go after that say, so we get a grant or we're going after a grant and it says you have to have a letter of support from the community or you need to have a community advisory board. Like, is this a need or a real genuine interest? I certainly have in many experiences had, I need a letter, and then that doesn't always set so well. So thinking about that. And there's ways to do it, but really thinking about the level of information you'd like and the level of engagement you'd like. Are you willing to take your expert hat off and realize that you are not the expert on this community? For the most part, some people might be, from the community and have a very different lens. But most of us that are in academia go into communities that we are not part of. And so there's no way to know that. So are you willing to take the expert hat off and realize that in this setting, you are not the expert? Are you willing to compromise? And if so, on what? Like, are you truly willing to compromise? Now, we know, and we talked about this a little bit in the first session, sometimes there are things that we can't compromise on. So if you can't compromise on something, are you willing to take the time to explain it? Are you willing and open to being told no? Because in any true engagement opportunity, the community could say, not now, or not at all. That is just not our approach. And are you willing to adjust or respond to community issues? And I think COVID was a really good example, kind of drastic example of this, because there were a lot of partnerships that were in process or maybe very established, that whatever work was being done had to stop on a dime. And, for all of the academics, we still have our academic timelines. We have our grant timelines. We have our teaching schedules. But the community had to drop everything and respond to the needs of their community at that time. And we had to be willing to adjust, maybe support, help them, and be patient with the changes that they need to be made. And lastly, are you interested in building a relationship? Because as mentioned in the first sessions and in the plain language session, it's about building a relationship, and the way we approach, and especially with levels of community engagement, that relationship is more and more important as we go along. So I come back to this community engagement continuum. And, really in this session, we're going to be talking more about, like, from the consult section all the way up to shared leadership, more so than outreach. I mean, outreach is certainly very important, but it doesn't require the same level of thoughtfulness in terms of approach that you might need in some of the higher levels of community engagement. So thinking about a community engagement plan, and I think being very purposeful in this area helps you to kind of get all your ducks in a row before you go out and address a community partner, and makes you step back and do that thoughtfulness. Just like with doing a study design or a curriculum, the hard work is on the front end, and really thinking about what you need to do to make your grant, your curriculum a success, right? All of that is pre-planned. You don't like wing it on the fly. And the same holds true for community engagement. Thinking it through ahead of time, what your expectations are, how you're going to move forward with engaging the community, what level of community engagement you want. Doesn't mean it might not change, but it certainly is something that can help guide us and to give us a little bit more confidence in our approach. So just defining your goals and thinking about how can community help you, right? You have a goal in mind, curriculum, policy, some sort of, again, a grant deliverable. So you know what you need from the community for the most part, right? Sometimes it's like really thinking that through. And again, I'll plug our community engagement core. These are things that we can help you figure out. Like how can a community engagement involvement help you? Because if you're like, oh, I'm not quite sure what I would even go and ask for, we can help brainstorm those things. But even more importantly, doing community engagement, especially the higher level of community engagement, you can't go in without thinking about how you can help the community. What does your work do to help move that community forward? What are we leaving behind? What types of other opportunities might we create? Is there alignment in what we're doing? So what's in it for the community is really hard. And, it's something that I have stumbled over lots and lots of times. One project I think of in particular is, I love doing community-based work and getting data specific to various communities. Well, I'm going to tell you right now, communities could care less that you have local data. Like for me, that's really exciting, but thinking about how a community, but you could use it for policy and you could use it for this. It doesn't resonate the same way it does for us academics. So really thinking about what's in it for the community. What change can your project help to create? Can it actually have direct impact on health? Does it bring resources to the community? Can it influence policy? And sometimes we say that, but we might have to show how to do that and how to bring those two worlds together. And is the relationship something that maybe, as it evolves, can benefit each other more and more greatly? So then it's thinking about, once like we think about what's in it for the community, we can have a better sense of things. And by doing this and building that relationship and being that transparent, like we want to do something for you too, helps to contribute to our institution's trustworthiness. An institution, and I know we talked about this in the first session, but every institution has to deem itself trustworthy. And in these large institutions, that's a challenge. I mean, there's history and there's so many people that, some of us move things forward and others might set us back a few pieces. But anything we do in terms of community engagement helps to establish our institution's trustworthiness. It helps to increase science literacy and health literacy, which is so important on many aspects and is something that is then left behind in the community. It's not like a big boom of a result, but it's something that over time, I think helps people to have more voice in their health and in like asking about research outcomes. And we can educate our community partner, but we can also be educated. And that helps us all to develop and move things forward in much stronger, opportunities and much stronger ways. And what we learn accumulates, right? So we learn more and more about these communities. And the next time we're reaching out, it's that much quicker and that much smoother. So the first thing to really think about is where do we even start? How do we select a community or a community partner that we want to engage in? If you're a researcher, it might be like, okay, we really talk about a certain group that might be most impacted by a condition or a situation. For education, maybe, you're teaching in a very specified area that you're going to be focusing in on a certain population. But really thinking about the who, what, when, where, and how. Who is aligning interest or expertise? Again, this could be industry. This could be other educators or other systems. It could be community-based organizations. It could be patients. But who has that aligning interest or an expertise that you don't have that someone else can bring to the table? Who will be impacted by your work? what community partner will meet your needs? And again, it's not just about your needs, but if you're the one reaching out, you want to show that there's some alignment there, and to start with, okay, what do I really need for this project, this curriculum? What is it that I need? And who is the best partner for that? Is it industry? Is it an educator? Is it a physician? Is it a patient? But never to be locked in by one community partner. Your needs or your wants might be very broad. And so having different community partners engaged in different times or different areas or different phases of your work is totally okay. This is a really dynamic, non-linear process. So what do you do at what time? What's your timeline of activities? Because these are all these things that you need to be able to communicate when you reach out to a community partner. When is the right time to engage? Where does the engagement happen? Do people have to come to campus? Are you willing to go to them? Again, if it's a business partner or an industry partner, it could be by Zoom. I mean, even basic, your kind of town hall type meetings can be done by Zoom. But some might take your more traditional meeting approach where others might not. And thinking about how we can relate. Is there dynamic change over time? Most of the time, when I have a meeting with community partners, no matter who they are, but and even if I'm working across disciplines, there's always those first couple minutes of, how are you? How are your family? What's new? What did you do for the weekend? Did you watch the game the other night? You're building a rapport. We're relating to each other in a different way. And a reason that we can all agree that we have something in common. We have life outside of our business or outside of our work. And those are some ways to really connect with people on a very different level. Finding somebody that likes the same music as you, or like those little kind of magical things that seem not important can really help facilitate the development of a relationship. So know the community partner as much as you can, or the potential partner. Because right now, if you're going in cold and you're trying to establish a new partnership, you don't know if this individual or this organization wants to work with you in the first place. Thinking about, and again, I know we talked about this a little bit, like the idea of do your homework. Really think about the communities that you laid out on a piece of paper and said, the lived experience of this group or this organization or these patients would really help me to understand my work better and how it impacts like real world implementation. So do your homework. There are things that we can learn online about community nuances, culture, all of those kinds of things. But never forget that there's stuff that you're not going to learn online. But do your homework first. You don't want to learn everything on the fly. And I think people really appreciate when the time is taken to do your best to understand what some of those things are that make a community unique and special. And make sure your engagement plans fit the community. I know, for example, maybe understanding computer access in underserved communities, or maybe you're working in schools, and some schools more and more now have, Chromebooks or something that their students can work with, but do all of them. If you're working with a rural community and you're doing mostly internet, we still have rural communities that do not have really good internet service. So thinking about if you're going to do all online, that might not be the best fit for some of these communities. Certainly accept that you're not the expert. And don't be afraid to ask questions, certainly in a diplomatic way. We know that we don't know everything when we do a Google search about a community. And so finding that person that could say, this may sound really naive, but I was wondering, I've done some work and I've read some information, but I still don't understand this about your community. Can you share that with me? That's okay. And I think that people really appreciate that. So you're going to make mistakes because we can't all go in super prepared or uber prepared because there's things that we can't find online. We're going to make mistakes. Be prepared to make them, be prepared to apologize for them. And most of all, just learn from them. Just like when you're teaching or you're, you have all levels of learners in your labs, people make mistakes. The important thing is that we learn from them, we move forward from them, and we always then have them in our toolkit for moving forward with a potential partner. Definitely be prepared to compensate. This is something I think that's really important, especially for our partners. Like from the research perspective, we're used to volunteering and asking people to participate in our studies. And I think most of us say, oh, we'll give you a gift card if you participate. But for our partners, this is not part of their jobs. If we're working with a community-based organization, some might align beautifully. And you might say, this is what I need to do anyway, so we're going to just work together. Others, don't expect that they're just going to volunteer. You need to make sure that you're prepared to compensate for them for their time. We get paid for what we do. And we can't just assume that everybody else is willing to just volunteer. And another thing too is to really be prepared to give voice, to recognize power differentials that are in the room. Depending on who your partner might be, so if you're an MD or a PhD, that automatically might shift the balance a little bit. Now, if you're working with a CEO of a company, that power differential might dissolve pretty easily. If you're working with patients and you're an MD or a PhD and you're working with people that maybe don't have a high school education, there is definitely you're the expert. You have letters after your name. You are the, I'm not going to say much. And it takes time to shift those differentials. And the differentials are all different, but we have to be aware that they exist and really be thoughtful about how to approach them. One example is if you're working with teenagers. Teenagers very often don't feel like they don't have a voice in anything. Part of that might be their age and their stage. But if you really want to have youth partners, you have to figure out how to make sure they have a voice at the table and that they feel that they're in a safe space to say what they need to say. Let me stop there. Any questions or any experiences anyone would like to share?
There's no questions in chat at this time.
Okay. Okay, so thinking about goals for our community engagement, and these are not goals for your project, okay? Because we all have goals for our project, our curriculum, our research grant, but what are the goals for your engagement? So what do you expect to walk away with from the partnerships that you're developing? Again, is it a relationship? Is it just, a one-time consultation? Like what is it that you're really asking for, and how are you going to know you've achieved it? So going back to SMART objectives, and I'm sure you've all heard that, measuring to be specific, measurable, achievable, reasonable, and time sensitive. Are your goals SMART? But for the engagement, not for the outcomes of your project. So, and again, thinking about the timeline and everything that goes into it, you're not going to have a full-blown partnership and relationship if you have a 3-week timeline. So what is your expectation of, I need a letter of support. I need a community partner for this grant. I have 3 weeks to establish some sort of partnership. What do I hope to obtain by that point? You might go further on and develop that relationship further, but be realistic about what you hope to gain by that 3-week time point, because your community partner might be like, oh my gosh, I have to run this through channels. I have to get approvals for this. Like what are you hoping to get away with, and be willing or to get established, and what kind of bumps in the road can you anticipate? So thinking about making the connections, you can certainly do a cold call. You can certainly just pick up the phone, say you're so-and-so and this is what you're working on. And from what you've learned about their organization, there might be some alignment that you'd like to discuss and potentially a partnership or a collaboration. Cold calls, I think, can be really difficult. I think, and certainly Googling just to kind of figure out what's out there, who does have an aligned agenda that you can reach out to. But number one, I would ask for help. There are a lot of people who are very well connected in the community, and ask them, do you know of anyone who you think might align with this? Yeah. Oh, you do. Can you introduce me? Can you do a warm handoff? Warm handoffs, I think, are really great because you're establishing, it's kind of helping move that trust factor along. If you know someone who works with a community partner that might be, interested in your work as well, that's already that connection. And thinking about, again, what do you want out of that connection? But scheduling a meeting, and again, depending on who you're reaching out to, that might look pretty different. If you're looking at business leaders or organizational leaders, it might be our traditional meeting setup or style. If you're looking to meet with patients, it might be very different. It might be sitting in a waiting room at a practice to have some, with permission, of course, to kind of engage with people in a different way, and then inviting them to a meeting. Sometimes it means meeting at a coffee shop. Sometimes it means meeting at the other person's organization. Again, Zoom makes it very easy, but thinking about who does Zoom work for and who doesn't it work for when we're doing that. And again, our community engagement core is very willing and interested in helping to do that brainstorming with you. Any questions or comments so far? I think we're good. All right.
You're good.
So then preparing for engagement. So, you kind of want to have not a set plan, because a set plan means that you haven't co-developed something, but have a straw man of what you want to talk about. Like, go in, engage. Oh, and the one thing I did want to mention that I forgot to is about going to community meetings. If you're a lot of community organizations hold open meetings or have coalition meetings around certain topics. And that's a great way to meet people and just to go and listen to what's going on in the community. Sometimes they're kind of hard to find because they're not there's no website that says all these community meetings. You kind of have to do some searching, and again, some warm handoffs can help you with that. But those are great ways, especially if you just want to go and listen and absorb. Okay, so some of the things that we could do to prepare is really thinking about previous work that we've done. What are best practices? Getting some of that information together. If you're a researcher, an educator, what worked in the past, what didn't? Like what can you build on from what you've already done that can help that conversation move forward in a very fluid way? Again, doing your homework, understanding community context. Are there things that go on in the community that you can build on? Are there things that events that occur, or different types of we have one researcher that has done some really interesting work building on food bank. She's doing some work that she's present when there's a food bank, weekly food bank. That's really important. And you can build on that activity and show how that there's more alignment and you're willing to be there and maybe roll up your sleeves a little bit too while you're there. Thinking about the relevance of a community context. I think one of the biggest examples and is the May 14th shooting, and thinking about like the East Side community. You have to be relevant. You can't go in when during a crisis time and think somebody cares about your project. You really need to think about what's most important, what's relevant, and what your timing is really good for. And it doesn't mean that things can't move on, but you need to be sensitive about these things, and sensitive and very transparent. And I think all those things can help to build that understanding of the community context, because as you're being sensitive and transparent, and even just saying, I know this might not be the best time, but these are some work that we're doing. What can we do to help you? What can we help you to do to get back on your feet? Again, what's in it for the community? Okay. Again, I'll stop there. Doing your legwork, thinking about community context. I see there's some things in the chat here.
Yeah, actually, just about the slides. No questions at this time, unless
Okay,
they were directed to you.
All right. Okay, I see when I get stuck here. Okay, so once you kind of know and have some thoughts about, your community, maybe you've had a community partner agree to work with you or offer some guidance. Again, maybe it's a one-time consult. Maybe they're willing to be on your community advisory board. Maybe there's such strong alignment that they want to partner with you on a project, a curriculum, a policy brief, whatever the case may be. But being able to articulate why the community partner is important to the work, and the work in general, not just yours, but theirs too, and how these things come together. How does an organization or member benefit from your work? And how does a community benefit overall? Okay, so even community organizations have their constituents at the heart of what they do. So it's not just about what's in it for the organization, but what's in it for the people that they serve. Go back to the principles of community engagement. And again, I have a link if anyone is interested for the new principles of community engagement that was released a few weeks ago. But thinking about how to explain the alignment. It's not just about your work, but what are your overall interests and goals? And how, maybe it's working with the American Heart Association. Maybe you do cardiovascular work, and a partner might be the American Heart Association, and they have a lot of educational opportunities, and maybe there's some ways that you can bridge those two worlds. Maybe they have an event that you'd like to be at, to be a speaker, to talk about your work, to disseminate your findings. But whatever it is, explain that alignment. Why, you're going to them, you call for a meeting, and you're on the phone with them, and you're trying to explain, why are you reaching out to them? And then when you're meeting, to describe your steps, your timelines. Be super transparent. If you've got something that you this isn't sometimes you might reach out and just say, I just want to learn more about you and maybe some possible collaborations. Great. The reality is oftentimes we have an end game that we need to meet, and we need to move things forward in a much quicker way to turn around whatever deliverable we're trying to turn around. So say that, describe your steps, your timeline, what types of activities, get feedback on those things. What's your follow-up going to be like? So really thinking through, it's not just going and saying, oh my gosh, I need this and I need this by tomorrow. But maybe you do. Maybe you need a letter of support by tomorrow. And you say, you know what? I know this isn't ideal, but I'm writing this grant. I need a letter of support. Our missions seem to align. And after having this conversation, it sounds like they do align. would you be willing to give us a letter of support? And it can be general. I'm not asking for you to commit to anything right now because I know we haven't had time to talk it all through. Prepare a letter that's general, but don't over expect what a community group or a potential partner is willing to do, especially on a short time frame. So it's okay to ask those things, but it's the way it's asked, and it's also the way it's followed up. I will let you know if that grant gets funded. Maybe we could have a couple meetings along the way to see how we can move forward together, whether or not this opportunity comes through. The grant gets funded, you go back to them and you say, grant got funded. Maybe we could talk in a little more detail about, how our partnership can look. So being transparent, being willing to co-design and take steps forward and back, but just to manage those expectations. And then certainly if we're moving things forward, we might need training, either researchers, what do we need to learn about? Do you have, there's some great cultural competency trainings out there that really help us to engage. My team and I just took part in a community health worker stakeholder training a month ago that was amazing. And even though we, we have all lived in an engagement in a community-based setting for a very long time, we still learned a lot by participating in that training. But it's also what do your community partners need? Do they need city training for if they're a research partner? How can we help that process? And again, the further up you go with the community engagement piece, and how is it shared leadership? Is it collaboration? Then we should be seeing more and more co-creations, not researcher, academic, educator coming and saying, blah, here this is. It's, here's my draft. I did this just to get us started. What do you think? Tear it apart. Give me your ideas. Like, really help me co-create this so it's something that resonates with the community. So selecting methods, aligning our goals, maybe, for example, maybe your community partner has an event planned that there's some way that you could piggyback on that. And it makes sense and it's thoughtful about how it's done. Again, thinking about the levels of community engagement and the co-creation. Hosting a meeting, sometimes this is like, so we take it for granted, but again, thinking about time and place, how frequently we're going to meet, also depending on the level of engagement. We talked a lot about this already, but being open to feedback. But I think there's two things, food, and I put question mark there. It's always good when working with community partners to break bread, to come to the table together, to share a meal. Unfortunately, the way our funding often works, that is very limited. But it's just something to think about. There have been plenty of meetings that I just buy a case of water and some snacks just to have something, that at the table. But most importantly, with these meetings and with the iterative process, especially as we're going up into collaboration and shared leadership, these meetings might take you back to square one. You start with your straw man, and truly you have to go in knowing that this is a draft. The meetings might open your eyes to a whole different way of looking at things, or a community partner might say, you know what, that would never fly with the people in this community. So being ready to change ideas and open to that, and open to being creative around the table with your community partner is really, really important. So here are just some things, types of methods to engage. Demonstrations, for sure, like the more we can show as opposed to just expect somebody to read something. I think that's something that we definitely do when, even in the outreach side of things. Nobody wants to go to a table full of paper. I think, we want to demonstrate components. And and thinking about really creative ways to do that. Dr. Surtees does DNA extraction in the community, and that really goes over well. People get really excited about that. Thinking about how do you showcase, we're talking about DNA. What does that look like? Do we have a model at the table so someone could actually see what that means and that it's part of a cell, like kind of a linear progression? Perhaps if you're doing something on breast health, having, models there that have tumors in them so people can really understand what that's all about. So it's all sorts of different ways we could do that. Certainly presentations, but doing a community-based presentation really needs to be based in plain language, and should be set up for more lots of question and answer and lots of dialogue as opposed to something that's much more didactic. Doing newsletters or flyers depending on what your outcome needs to be. Certainly thinking about social media, and this can be challenging. I do find I've set up a Facebook page, and I know that's probably geared towards a certain age of audience, but I worked with our IT group, and they were really helpful to think about what that Facebook page should look like, how to manage responses, especially negative responses. So I do encourage you to use our resources here at UB, because I do think they're very helpful and made me think a lot about, this isn't social media and all that isn't my field, but it helped me to really understand how to think about setting something up that might be meaningful for a project. Town hall meetings, going to health fairs, open houses, events, holiday festivals, and things like holiday festivals. It's not just about you bringing your work there and having a table, maybe demonstrating something around science literacy or health literacy, but maybe it's doing a gift drive or a book drive or something that you're giving back to the community. Going to community-based organizations, being part of fundraisers, being visible in that area. Again, we do for community engagement studios where our team at the Community Engagement Core will do the legwork for you and bring community experts in for a consult. We're in the process of developing science cafes to be able to help facilitate researchers bringing their work into the community around an area of interest that the community has, and having a dialogue about what research and science is going on in those areas that are helping to improve health. But it's more dialogue than lecture. And certainly establishing community advisory boards. So there's lots and lots and lots of different ways to engage at different levels. Okay, questions, thoughts, challenges. I love challenges. Let's debate a little bit.
We have one. Can you give an example of a current project that is going well and one where you had to overcome a barrier?
Sure. One of the examples I'm going to give is an older one. So of one that had to overcome some barriers. So I was in a project, it was a community, I guess I could give you, I'm trying to think of there's lots of barriers. And I'm trying to not give the examples that I gave last time, but I know that there was one, a lot of that I learned very early on. I did some community needs assessments, one in the west side and one in the east side. And this was where I really got my kind of a lesson learned in how different those communities are. So again, this was back before we had a lot of new new American settlers on the west side. So it was mostly our Puerto Rican community. And here I had engaged with them in a certain way and was learning as I went. I was young, I was a new researcher and really enjoyed that. And then we did a similar study on the east side. And I remember talking with a pastor because I was like, I don't get it. I'm doing some of the same things, but it's not really connecting. And he was so kind to me, but really sat down and said, you cannot even think about this community, or like they are so different. And you really have to start from square one and learn and understand the politics and the relationships and the nuances. And that was like, I'm so thankful he was so kind to me and gave me a lot of really good advice about that I take with me to this day, because I never enter into a new community thinking that I know anything about it, because I didn't. And I made a lot of mistakes going through that community. Now, so fast forward, the study went on, and there were some challenges with other members of the team. And so long story short, I didn't have the full report. This report had multiple components and multiple pieces and multiple players, and I had my section of it. And the group was very frustrated because they wanted an electronic version of the full report, and I didn't have it to give. And so I shared that, but I don't think that there was enough trust built at the time, where I looking back now, I'm like, they totally thought I was just not wanting to give it to them. And I kind of you just had to eat a little crow and just walk away and say like, oh, geez, I don't want to keep pushing because that's not helping. Long story short, and this is over time, turns out that I don't know what happened, but something happened where they realized that I really did not have access to this full report. And it took some rebuilding and some regrowing, but many of those partners I reconnected with, and we have a really nice working relationship with. So I guess that's like one extreme about just overall community and the importance of the trust in that role. I think another misstep, and I believe I might have shared this at the first session, but was working with a practice partner who was very small at the time, has grown a lot since then. And we put a lot of we gave them a large part of the budget for the work that they were doing. And it really caused them financial strain. And again, this was not intentional, but it caused them financial strain. But because we had a lot of trust and experience working with each other, we still work together to this day. We were able to say like, okay, then we're not like anything we do together, you're not going to get the budget. We'll maintain the budget and just give you the budget that you want, because it puts so much financial strain on their cash flow, which can happen with any small community-based organization. So those are two things that I know I really had to work around. Personally, I'm trying to think of some other researchers' examples of things that just didn't work. But then there are a lot of examples that I think are really great. Dr. Kruger is the example I gave about how she's working. She does some work around dental health, and she's partnered up with the food pantry at the Seneca Babcock Community Center, and that has worked famously to build trust. And they're there to roll up their sleeves, but also to talk about research and to engage in different research activities. That is truly, like, I love that. When I hear about it, I just think, oh my gosh, that's just so brilliant on how they brought these two things together. And it's certainly a win-win for the community, because they're bringing in, they're not only doing research, but they're bringing in some dental services as well. So in a way to reach people in a comfortable and safe setting.
Great, thank you. We have one more question. It is, what would you do if you get initial community support, but then when it comes to doing the work, the community is not responsive?
Yeah, and I think that can certainly happen. And I think understanding why the community is non-responsive, like is it because of a community context situation where something came up that priorities have shifted, or is it or are they just ghosting you and you're not really sure why? So I think it's really kind of understanding that background first, and being transparent about timelines and need. So like if it's something that's result of, my goodness, maybe it's a community organization that just had major cuts and they don't have the staff that they once had, or something like that. Like those things happen, and that shifts very quickly in terms of about what other extra things there are to do. So I think having those examples of, is there still a piece of this you can do, or what would make it, feasible for you to do? Maybe it's, what if we engaged a student to help you and do this? So understanding why the community partner is invested and, and being responsive, and then seeing if there's, again, some aid that you can give or some support, or just the grace to say, like, I get it. This is not a good time for you. I'd like to keep the door open. I need to move forward with my timeline, and I hope you understand that too. Do you think there's, can you recommend somebody that might be willing to carry on what we started? And maybe you could still be invested, but just at a much smaller level. Like, so I think it's really understanding that the behind the scenes.
Great, thank you. Those are all the questions we have at this time.
Okay, so I think the next piece is the breakout rooms. Where are we at? We're just about 5 o'clock. So doing some breakout rooms, and we just wanted to kind of throw out a scenario and, of going into a community with a project, and, this project to aim to better communicate risk for COVID. We all know that one message did not fit every community during COVID, and certainly caused some mistrust around science and around other things that we don't need to get into. But in other emerging infectious diseases. So one strategy this team came up with was to do a public service announcement and to develop public health messaging in plain language that is disseminated through a faith-based network. So the question is then, how might you engage each of these different communities in this plan? And what are the pros and cons of this strategy in each of these communities? So I think we're going to break out into small groups. I'm trying to see how many people do we have here. I think should I stop sharing?
Sure. Yeah, I'm creating the groups now.
Okay.
So
we have 18.
Yep, that's good.
Yeah.
So you are in one room, you're in room 2, and Grace is in room 1 naturally. Are you good with that?
Perfect.
Okay.
Perfect.
So I'll just open all the rooms. We easily have 10 minutes. So we're going to meet for 10 minutes. So I'll open the rooms now.
Great. Thank you.
Thank you. Okay, Laurene, everyone should be back now, or on their way back in the next 10 seconds.
All right, great. All right. Group 1, do you want to showcase any of your conversation?
Sure. So we talked about the scenario and how it would be with the Hispanic community. So we talked about the public service announcement needing to be in English and in Spanish in plain language at the fifth grade reading level. And then also any other languages besides English and Spanish that might be appropriate as well. And then really before even designing the public service announcement, understanding the history of the community and the attitudes of the community towards COVID, and is COVID even relevant in the Hispanic community? Um, and also, kind of making a plan for what community education might be needed, or any health literacy information that might be distributed, um, and how to be sensitive about the topic with that specific community. We talked about having a listening session or a community engagement studio beforehand, so that the community was on board, from the conceptual, planning phases all through the, production of the public service announcement and how it would be distributed as well.
Great, thank you. All right, I can give a little bit of, we took it a little bit different. Jayla, do you
Okay.
want to give an overview?
No problem. So we discussed how to pretty much just take a basic message, public health message, and manipulate it to our audience. We realized that every audience has to be met where they are, and to have those conversations, you can't just commonly approaching the Black community when it came to medical information during COVID or post COVID or during COVID. It was the idea of working with faith-based organizations, which we decided, that is only going to take a very specific population. And though it may focus on a large population, we want to make sure we meet everyone where they are, and including even coming from rural communities or disabled community, and being able to meet them, based on interest and based on following. Did I cover everything? Did I miss anything?
I think, great job. I think, yeah, like, so we took it from a broader, like, variations in community approach. So, yeah, so this was a great conversation because there's so many different ways to look at these things, and really, again, getting back to the community context of what we need to understand. And again, the other thing, I guess, the last thing I wanted to mention in our conversation was really thinking about time frame too, and when these public health messages, like how quickly we need to think about tweaking them, and there's really not like a good system in place to do that at this point, but that there's strong community messages out there that are broad reaching. Let's see, I have just a couple more. Let me see here. So just to thinking about some pitfalls that, to summarize, thinking about unclear expectations, miscommunication, it happens, timelines that are not in sync. My rule of thumb working with the community is to under promise and over deliver, or at least be accurate in terms of what you can promise, because a huge pitfall is over promising and not delivering. That just feeds mistrust. Again, not being trusted by the community, and having the institution not being trusted by the community, that adds extra legwork to the work that you have to do to develop that relationship. And certainly people dropping the ball and lack of follow-up. I can't tell you how many times I've heard, well, so-and-so came and asked me for this and for that, and I said, okay, and then I never heard from them again. I mean, that is an ongoing problem and creates mistrust and frustration with the institution. So key takeaway, it's not as easy as it seems. It certainly takes time. It needs the right approach. It needs to be intentional and mindful. You know, and I think about that with, again, just even as basic as outreach, being thoughtful about who our audience is and what type of information do you want to take. And I'll stop sharing now because like we were just talking about it recently. We have an event at the Science Museum that's mostly younger kids, like say up to 6th grade. There's an event at Performing Arts that's teenagers. There's, you know, like then there's a family health fair. Like, what do you take? What do you do? What's the messaging? It's all very unique and purposeful. And you can take the same thing to all 3 of those events, but is it going to resonate as much as if you adapt what you're doing a little bit to really meet that whatever community you know you're going to be interacting with? So thinking about that and being very intentional in the approach that you take. So I guess we have a few minutes for conversation and for discussion. If, you know, if anyone has any points or wants to, again, share some of the experiences you've had. I know, and even in education, just finding that those right, you know, we talk a lot about service learning and how interesting and important that is for students, but also for community. There's a big win-win in it if it's done well and done right. And you can't always predict the community context and, you know, changeover in staff. Like how many times does that happen? You set a student up with a community organization and that person leaves, and then all of a sudden the student is like, oh my gosh, I don't know what to do. Like it's a really dynamic process, no matter what your outcome is, education, policy, research, thinking about needing to pivot, figuring out when you need to pivot and being able to pivot to be able to make sure we have the best outcomes.
Excellent. Thank you. If anybody has any questions or wants to share something, please remember this would be the time to ask. And I also want to remind you that if you do encounter issues or you do need help, we have a wonderful community engagement core that is always willing to help you through the process, no matter where you are in the process. That's what's most important. Laurene and her team, Grace is on, Ryan was on, I think she still is, are wonderful and can easily help you. And they're very easy to talk to too. So it's really, really a great core. So please, please, please reach out to them. And if anybody has any questions or wants to share something, please do so. If not, thank you very much for coming and feel free to sign out and have a wonderful evening. Bye.
Thank you. Thanks for coming, everyone.
Thank you.